Nearly, yes.
Okay, well, welcome to the Health Overview and Scrutiny Committee, everybody. Thank you, Nicholas, for being here for this extra meeting. It's very much appreciated. We'll open the meeting, and the first thing is apologies. Madeline, do we have any?
Councillor Firmager.
And Emma is standing in for Councillor Firmager, is that right?
That's right.
Declaration of interest. Are there any declarations of interest anyone wants to declare? Nope. Public questions at all?
No questions.
Member questions?
No questions.
In that case, we can go straight into the single item for this meeting, which is the update on the Wokingham Health Watch. So, Nicholas, I notice your microphone is on, but I haven't heard you. Are you actually there? I can see you playing with the mic.
Yes, it was me who spoke a few moments ago, saying to ignore pages.
Lovely. Okay, no, that's absolutely fine. Just wanted to make sure that you could hear us and we could hear you. So that's wonderful. On that, Nicholas, would you like to guide us through the parts of this report? Again, skipping the pages 13 and forward 15, which, as you said, seems to be wrong for the report. And then we'll ask questions after that, I think.
Okay, well, I'll summarise it rather than read through the whole thing.
Yes.
That's
yes.
Okay. Now, as you'll know, the way we work has changed considerably under the pandemic because we can't carry out community engagement in the way we used to carry out communication engagement face-to-face. So a lot of our work has been around digital formats, and we're well aware that we can fall into the same issues that we challenge other service providers about, and that's digital exclusion. But we're looking at ways that we can perhaps get around that. So a lot of our work has revolved around providing the right information, the information they need, because we were hearing from individuals that they just couldn't find the right information quickly and easily. So we've tried to produce reports based on feedback from the local population and others that we thought might be interesting. So as you can see there, it covers a whole range of things. Reducing stress for parents and non-accidental injuries, because the RBH were finding an increase in young children who were turning up with non-accidental injuries. Information for those with dementia and their carers. Information about coping with drinking habits during COVID-19. Support for new parents, because a lot of the support they got disappeared. There was no visits from health workers. Some GP appointment checkups were changed. A bit about eating healthily. The changes to the maternity services and visiting Royal Berkshire Hospital, because pregnant women were getting mixed messages. We produced something about how to get an NHS dentist appointment, what you can do to help search for one, because we heard that quite a lot of people couldn't get an NHS dentist appointment and couldn't get an NHS dentist once the services reopened. The way people are discharged from hospital had changed, so we provided information on that. There's rapid discharge from hospital now. You'll get support at home for 6 weeks, but after that it can stop, and the cost may be applied to you. We asked people for their feedback on Royal Berkshire Hospital rebuild, particularly the vulnerable groups, so people like the Learning Disability Board, just to make sure they had the opportunity to give their feedback. There was a piece about coronavirus is affecting my mental health, what can I do? and then some detailed information about visiting care homes. We also had our survey. We did it across the West, Wokingham, West Berkshire, Reading Health Watch. We had over 680 responses in all, 174 for Wokingham, that asked various questions about ranging from what was their mental health like, how did they find getting information about services. So just about their experience, what was their experience of having telephone calls with doctors or video calls with consultants. That report's finished now and it's just being checked, so that will be published shortly and you'll get a copy of that. So we continue to connect with some of the local voluntary community sector groups. So for the vulnerable, so for the Learning Disability Board, we join their weekly Zoom meetings on a regular basis to pick up if there's any health or social care issues affecting them during COVID. And we shared and raised issues of high concern, and they're listed there. The issue about dentists, difficult to find information on health providers' websites, mental health deterioration, COVID restrictions creating barriers for deaf people who need to sign and lip read, ongoing delays in CAMS. I know you're organising to have CAMS come in and talk to you, contacting, accessing GP surgeries, and we continue to work collaboratively with their Health Watch partners and working closely with the CCG, hospital trusts. The one thing I would say is that collaborative working has been much improved. You know, a lot of the time we found it difficult to access places like the CCG, the hospital trusts, the integrated care systems. But they found it beneficial to collaborate with us because we could help them spread the message. If we go on to the next page, there's a bit of background there. It's really about what I was talking about how our work's changed. And if we go on to the advice and information, so in the last 3 months, we've had a greater focus on our information, advice and signposting service. And the number of interactions on our website has increased hugely. So you can see we've had over 3,000 views on our website, over 1,400 new users, reached 15,000 people on Facebook, good response on Instagram and particularly on Twitter. But we haven't used those just to keep on banging out messages. We've tried to be selective and timely to focus on what was really important, so it got people's attention. And then if we go further down, we've got what have people been telling us and what action have we taken, and this is just a selection. This isn't the complete list, it just gives a flavour of the sort of things that we've been hearing.
Excuse me, can I just interrupt? I've just got a message, Ken and Madeline, from Rachel saying that she's trying to get in and she's not been let in.
It's okay, I am in. I'm sorry, Clive, I'm in now. I couldn't.
Sorry.
I got in on the 3rd attempt. I was sitting there in the waiting room with it saying the meeting hasn't started yet, you'll be let in. But it is the second time it's happened to me joining a meeting that I just haven't been able to join. Is Imogen trying to get in? She sent me a message. Yeah,
Not this
okay.
meeting, I'll look into it.
Super, thank you very much. Cheers.
Well, welcome to the meeting, Rachel. Nicholas, do you want to carry on, Nick?
Yeah, so some of the things we heard about. So class were finding it difficult to get easy read information about going for a dentist appointment. So we provided an easy read document for them. We also heard from them that a lot of them had quite high anxiety and worry during the COVID pandemic. So we sourced from Public Health England an easy read document on the subject of anxiety and how they can cope. Also, we heard that they couldn't find clear information about what individuals can and can't do after the 4th of July. So we passed on a direct link to the clear information that they needed. We had an individual who enjoyed managing their own medication, a Nomad pack. The pharmacy withdrew that Nomad pack. We talked about this before. That was Morrison's in Woos Hill. So that caused him some distress, and we can go back to that issue later on if you want. But what we did is, using Kevin Barnes, who presented for the Thames Valley Pharmacy Association, I think it was, he has been very helpful in helping us to resolve the pharmacy issues that we had, particularly near the beginning. And we managed to source another pharmacist to provide that Nomad pack for that learning disabled adult, so he could feel like he had some of his independence back again. Dentistry continues to be a lack of clear information and communication about dentistry. That's been the whole way through COVID. It's been really, really poor. People are telling us they couldn't find the right information about when their dental practice would start resuming services. So we created advice and information around that. One of the issues to come out of our COVID survey report was this issue about finding clear information, which is why we carried out the mystery shop of the dental websites and the GP websites. And you've got a copy of the report for the dental websites. CAMS, hearing from, this is just one resident. We've heard from more than one resident about the 2-year wait on ADHD pathway. Now, you'll probably get clearer information when you get to speak to CAMS, but my recollection is it's been 2 years for a long time. And there was meant to be extra money, you know, parity of esteem, to help reduce that. And there might be many factors about why it's still a 2-year wait, but it's an ongoing issue and it's causing local residents huge anxiety. Pharmacies, we've continued to hear some issues around pharmacies. This mother's daughter lived in sheltered accommodation and was not receiving accommodation, which should have been delivered to her home. The daughter tried to resolve it. The pharmacy wasn't taking phone calls, emailed the head office, didn't get a response. So she then contacted us. We managed to get it resolved. It seemed like what had happened was the driver would take it round to the sheltered housing, but the people running the sheltered housing said they couldn't allow him in and they weren't prepared to take it off him. So he drove it back to the pharmacy, but there was no pharmacy, no contact from the pharmacy to the patient. Deaf and hard of hearing. So yeah, we've heard from a couple of local residents about the severe barriers for deaf people who need to lip read or sign. And of course, if a doctor wants to phone you up or do a video consultation, video consultation is not so bad, but if it's not that clear an image, it's difficult for them to lip read. And of course, the use of face coverings, where you can't see the lips move. We've raised this directly with the CCG to ask why can't people wear face coverings with a transparent window. On GP surgeries, some people are finding it difficult to communicate the GP surgery because they can't enter a GP surgery. There seems to be different different setups in different places. I know my GP surgery, I can now go in and sit inside the GP surgery socially distanced, but there's still some Wokingham surgeries where you can't, they want you to wait outside. So there is a question about what about for the old and frail, A, if they don't have a car, B, if they don't have a mobile phone, and C, if the weather's really inclement, what are they expected to do? You know, stand outside for 20 minutes waiting to be called in. The Royal Berkshire Hospital, sorry, excuse me. Yeah, so we heard that the people couldn't find the information easily and quickly. And that left people from vulnerable groups frustrated and not sure where to get their information. And we were regularly meeting with Berkshire Healthcare Foundation Trust, and West Berkshire, Reading and Wokingham Health Watch fed back about these issues on their website. So if you compared their website to Frimley Park Hospital, the difference was like night and day. Now, they did have in their plans a project to rebuild their website, and after the feedback, they brought that project forward and it's underway. So it's gone through the engagement phase and they hope to have it up sometime in the autumn, probably late autumn. They're using the same team, I understand, that rebuilt the Frimley website. Yeah, that's it.
Nick, thank you very much.
That gives you a flavour of what's been going on.
Okay, right, we'll go straight into questions in that case. Hands up, Abdul, you were first. Councillor Loys, I can't hear you.
Can you hear me now? Yes.
I can hear you now.
Thank you, Chairman. Thank you, Nick. Out of 174 people who's got in touch with you from Wokingham, do you have any percentage or how many was relaying their problem regarding appointment, surgery appointment, especially the doctor's surgery? Would you have statistics different for different reasons? So I would like to know how many for dentists, how many for surgeries they had problem getting in or getting into the receptions, etc. Thank you, Nick.
So I don't have that report to hand, and I didn't forward it because it was waiting for sign off.
I see.
So I would expect to have it, be able to share it in the next 2 weeks.
November
Fine.
meeting.
Yeah, okay. Okay, I'll move on then. Chair, I'll come back again.
Okay. Clive Jones, your turn.
Thank you, Ken. So my first question is about CAMS. I understood 12 months ago that the waiting list to before you got an appointment was 9 to 12 months. So has it really deteriorated that quickly to 24 months, 2 years, or is it as a result of COVID-19?
Well, and that's why the last meeting, that's why I suggested at the end that it would be really helpful to have CAMS come in, because we have residents saying they're waiting 2 years. And I think it would be useful for us to understand, is that isolated cases? Are there longer waits for some parents than others? And if so, why is that?
Yeah. When are they coming, Ken? Madeline?
Madeline will know that.
They are coming to Children's Services to their next meeting, and the health scrutiny members are invited, and I think that's early November.
All right, okay. All right. And then I wanted to ask you another question as well, which is you've got Facebook. Your posts have been reached by 15,000 people, Instagram by 1,700, Twitter reached 12,000 people. Those are the figures for roughly the last 3 months. Do you know what it was for the 3 months before that, or for the corresponding 3 months last year? I just wondered if you're getting more contact, or has it gone down because of COVID, or has it gone up?
Oh no, it's gone up.
Gone up.
It's gone up.
Yeah. Would you know by how much? Has it gone up by 50%? Were you getting 10,000 Facebook pages posts?
Well, I can go back to the previous Insight report and compare the figures and give that information to you.
Right.
I'll dig that out while we're talking.
Right. I probably should have declared, Ken, and I forgot, because I've only just become the governor of Royal Berks Foundation Trust.
Oh, okay.
I forgot about that, sorry. I haven't got any other questions at the moment. Oh, you did mention that you had some people asking you about the consultation that the Royal Berks is currently undertaking as to whether they should move or not. Is that right? Did I hear?
Sorry, can you repeat the question?
Yeah. You had some people ask you about the moving of the hospital, the potential moving of it. Or did I hear that wrongly?
No. So what we did is we shared that information with local voluntary sector groups.
Right.
So that to ensure that they could have some input, because the trouble is when you've got these outside engagement companies who are hired to come and do this sort of work, they miss out the vulnerable people. So we see it as our role to make sure those people are included in that type of engagement work.
Yeah.
So we shared those groups' names with the company who are doing that engagement work, so that they could go and engage with those vulnerable groups.
Right. Did you get any response from anybody? Did they offer any opinion as to whether they should move?
So a lot of the response was less about where it was and more about their access, because those are the things that they find difficult. Access, transport.
Right.
Those are the key issues that face them.
Yeah. Well, if it was to move out towards one of the motorways, we'd have to make sure that it had a very good bus network and rail network.
I think the main part of trying to make, they have been connected into that so that they can share their opinions. It's a bit like the RBH website rebuild.
Yeah. Okay.
Because it was the vulnerable people who are finding it difficult to find the information. So a learning disabled individual trying to find easy read information on the Royal Berkshire website was incredibly difficult. I mean, I could find it, but it took me an hour and a half, 2 hours, so they're real barriers for certain individuals.
Well, that would be a barrier for me. I wouldn't want to spend more than a minute looking for them. To have to spend an hour and a half looking for something is, it definitely needs some attention, doesn't it?
So can I give you an answer to your previous question around the website? So in the previous report, we had 1,840 page views and 740 new users. On the latest one, we had 3,200 page views and 1,400 new users. For Facebook, in the previous report, we had 6,000 Facebook posts. On this one, we had 17,000, or 17,000 of our posts reached people. On Twitter, we had our posts reached, a second, I'm switching between documents, 1,500 people, sorry.
Right. Twitter was how many?
1,500. Sorry. I've got so many documents open, I'm flitting between. I'll come back to you with the Twitter one. But it was significantly more. It's 12 in this report. It was 12,000, and it was nowhere near that number before.
No. Well, Facebook, you say, has gone up from 6,000 to 15,000.
Yeah,
that's a huge increase, and you've had to. Well, I suppose you haven't had to respond to all of those, have you? That is just people looking at your posts.
They're looking at the posts, and we would have responses to some of them. And I think it's because we got better at, I would say we got better at what we were doing, as we were learning quickly.
This comes to another question, really, Jonathan, which is about funding, because your funding was cut a couple of years ago, and I and quite a few of the other members of the committee, in fact, I think I'm possibly right in saying, Ken, that most of the members of the committee didn't really want there to be any cut and didn't want there to be a merger with Reading, but it still happened, and I just wonder if we should be looking at reversing that. If you're having so much more to do, we should be looking at reversing that, and as soon as possible.
Am I right in saying that the funding now is supplied more centrally to a number of health watch groups rather than directly?
No.
So do you get a fixed amount every year?
Yeah, so the money comes from central government, but it's not ring fenced. And then the council decides what that funding will be. Our contract was due to expire or be up for tender again next year, but the local council, a week or so ago, just before I went on holiday, the local council wrote to all community voluntary sector groups and received funding, and say that will be postponed from a year for a year through to April 2022.
Oh, so there isn't going to be a review. There's no chance of you having it increased.
Probably not. I would say all voluntary sector groups, just for your information, in case you don't know, all VCS groups who received funding from the council all got a 3% uplift this year.
Yeah. Yeah, we were aware of that, but you've been cut from about 120,000 to 95 or something like that, if my memory serves me right. It'll be somewhere within those figures. So even with a 3% increase, you're still quite a long way from what you were 2 years ago. And now you're being told no more until no review until when? 2022.
Yeah, all voluntary and community sector groups, because I think what they wanted to do was do the tendering process for all of them in one go, and of course that's very difficult with the current situation.
Yeah, I can imagine it's difficult now.
So yes, we received a letter to say it's been delayed for a year.
Nick, where did that letter come from? Which council sent it out, or is it from multiple councils?
No, that was from Wokingham Council.
That was from Wokingham. Okay.
Yeah.
So I guess you haven't been aware of that, Ken?
No, but I wouldn't necessarily have been made aware of that. So I'm not surprised. That's why I asked the question.
Yeah. Okay. All right. Thank you very much, Jonathan.
Thank you, Clive. Who's next? Rachel, you're next on the list. Would you like to ask a question?
Hi, yes. I'm really pleased to see the work that you've done at looking at how deaf people are affected by this pandemic. and also people with learning disabilities. I wondered if anything had been done around other groups, in particular older people and BAME people. Now I know that the council, Woking Borough Council, has got its own survey about the effect of the pandemic on our BAME residents, but I wondered if Health Watch had done anything.
So we haven't done anything specifically yet because we're only a small team, so we have to pick the work we do, and there's so many areas that are worthy of being asked their opinion. It's quite difficult. So we were aware that the council were going to do a piece of work around that. So we can only really, with the team we've got, work on one project at a time. So the next project we're working on, we're preparing it at the moment, is, and that relates to older people, is the experience of carers, and particularly the new army of unpaid carers, the experience of them during the COVID situation. So a lot of those will be older people, you know, so you've got all these new unpaid carers who may not be registered with the council, may not know about registering with the council, would have faced all sorts of issues. You know, as an example, somebody who may have got to the point where they would have to put their loved one in a home, but that was the last place they were going to put them. So they've kept them at home. So I'm not sure that really answers your question. We haven't commissioned a specific piece of work around BME, but we have been thinking about health inequalities, which it would include people from the BME community.
Super. Is the health equalities work, is that general, or is that really around the issues of COVID?
Well, it wouldn't just be around COVID, it would be around all their experiences, you know, so it would include what's their experience before, during, and possibly after. But I say, that's a project we've talked about, but we wouldn't be able to do anything with that until we've done the carers project, which runs through to next year. And that's something that the board would have to approve as a project they want us to run.
Okay, but if it is approved, that may run from next year.
Yeah.
Okay, thanks very much.
There's lots of issues around health inequalities that affect lots of groups, one of which is the BAME community. The others are the more vulnerable groups, socio-economic groups, you know, those people who are living in areas of deprivation.
And I think that will also be very important and is very pertinent, obviously, to the whole COVID situation.
Absolutely.
Yeah, super. Thanks very much.
Okay.
Thank you, Rachel. Emma Hobbs. Emma?
Thank you, Mr. Chairman. I have a question about the finances. Well, it's not really a question. How dangerous is it with this extra finance that has not been offered to you? Is it for you? And if it's a very precarious state, would it assist to put something, you know, a plan of some sort for the council to possibly look at?
Well, certainly, you know, it's never great to lose funding, but that was part of the tendering process. And at the time, there was a real effort, as Councillor Jones will tell you, because he came along to some of the meetings, which included commissioners from Reading and Wokingham, and supported us, where at the same time they were trying to put together the two health watches, because that made sense to them. But because we collaborate really closely with them now, because we share so many services, so it makes sense to do so. But that would have really damaged the local health watch and the relationships that I can have with local community and voluntary sector groups and vulnerable organisations. The teams undoubtedly, if they'd spread across the two, would have been smaller, so we'd have even less people covering Wokingham. And the fact is, we're completely different. And where would our real local service and knowledge be around health and social care? Thankfully, I'm sure that Councillor Jones' presence helped. They decided not to do that in the end. But we did get a reduction in funding, and any reduction in funding, and you can always work smarter. And as one of our board members says, you don't always have to spend a lot of money to have really good outcomes, but it makes things more difficult. Undoubtedly, you can work, if you have less resource, you generally have to work on less things.
That's exactly it, isn't it, Jonathan? That if you, because you've got less money, you can look into a lot less things on behalf of the council and as councillors, because you are really our eyes and ears, and you can do less on behalf of residents. And to lose sort of getting on for 20% or a bit more than that of your funding was a huge hit on you, and you know, you would have been able to do an awful lot more over the last 18 months if that hadn't have happened. And it probably would have been easier on the couple of staff that you've got.
Yeah, I think we do rely heavily on volunteers, but less so during COVID, because a lot of the volunteers are older people who would maybe shielding or didn't feel comfortable doing it. Well, Help and Care, who run the Health Watch, who run several health watches in the south of England, that helps because it gives us economy of scale, so we can use their back office functions, we can share expertise across those health watches. You know, their directive to us, as was Health Watch England, you can't go and do face-to-face engagement. So some of the older people who'd volunteer for us and do that face-to-face engagement could no longer do that, or had the digital skills to help out. That's not all of them, you know, some of them still helped us, some of those who had those digital skills. But I think that's to be perfectly honest, that's something for us, and we've identified that we need to have a more diverse volunteer base in terms of age, gender.
Yeah.
I don't know the exact numbers, but I think it was more like a 10% cut. But even so, 10% is 10%, you know.
Okay. Okay, we've got Jim Fruin next.
I'm coming. Pressing the buttons. Oh, there you go. Got a couple of questions, but also I'd like to start with a thank you, because guiding people to the places to find useful information in the last few months has obviously been something that's been very, very beneficial. So thank you for doing all that for you and your team. If we go back to dentists, whilst the report you've shown is about the information contained on the website, if I read what was in the report correctly, the big issue was the fact that, or would appear to be the fact that, the dentists are only offering private appointments and not offering NHS appointments. I think as a committee we should look at ways we can follow that up to understand if we've got contractual obligations with dentists because they all look after NHS and they're not fulfilling those obligations, then I think we should follow that up. Second question is the RBH website. The number of times that I've heard a website update across many industries that it will be in the autumn, and it never said which year. Have we got anything with a date on it that we can actually see, or if we haven't, then can we invite somebody to present at a future committee meeting for us so we can actually see that there's been progress? And last question is, right at the start you mentioned that you've had an increasing visibility of cases of children with non-accidental injuries. Again, as a committee, I think I would suggest that it would be good to understand the scale of that, so we can see what follow-up actions have been taken, because I think it's, again, important that we understand how big a problem that is and what's being done. And lastly, and it's a question for Nick and the other gentleman whose name I can't see on my list at the moment, Jonathan, sorry, I can get you now, is there anything that we as a council can do to help in these current times? That's my lot.
Okay, so on the dentist side, it seems to be different dentist by dentist. So certainly the private dentists are working. If they have to do any work that presents an aerosol, drilling, extracting, that sort of stuff, they have to wear full PPE with a hood, you know, even more than perhaps some of those working in ICU. Those providing NHS dental services could do that if they wished, wear all the PPE and do some of that other work, extractions, crowns, drilling, but the PPE comes at their own cost. And some of those dentists decide they don't want to do that. So they are offering treatments to existing customers, but it's a very basic treatment. So I think what I'm saying, it's different across the board, and it's down to that NHS dentist whether he wants to go and purchase the PPE for his staff and do that additional work. The other problem, of course, is because of the cleaning down and everything that they have to do afterwards, they're only seeing, my understanding is 20 to 30% of the normal workload. But it's going to become a real issue. You know, there are people self-extracting teeth. And I think that dental services were meant to come to the last meeting, weren't they? But they didn't turn up. My memory serves me correctly.
That's right. They didn't come to this one either.
And my personal opinion would be we should get them in, because it's going to become, it is an issue. It's going to become even worse because there's no solution to that in the next few months. And the other danger is if you can't get an NHS appointment, you know, quite often dentists will be the first to pick up things like oral cancer. So what's happening about that? In terms of the RBH rebuild, website rebuild, we are due to meet with them again, so I'll ask them for an update. What I would say is they were fairly confident because they're using the same team who created the Frimley Park website and the Berkshire Healthcare Foundation Trust website. So they will be using a common framework to do that rather than building it from scratch, because that makes sense. It's quicker and they're quality websites. Of course, I know too, because I was in the IT industry before that, that's only part of it. You know, then it's the RBH who have to decide what the content's going to be. They have to populate the content, and that can be a delaying factor. There was another question. Sorry, it's slipped my mind.
It was the children with non-accidental injuries and the scale of that and what actions are being taken on to follow that up.
Yeah, and that was reported to us by the trust themselves. So that wasn't something we were hearing from parents, because you wouldn't hear that sort of thing from parents. So that was an issue. That's why we created a document about that, about advice for parents on how to stay calm if the situation's getting tense. But I think it would probably be worth you getting RBH, and it would probably be Victoria Parker who gave you the chat at the last meetings, the comms person, head of comms, to come and give you details about that and figures. Would you like me to speak to Victoria and see if she can provide me with anything? And if she can't, see if she's willing to come to a meeting?
Jen?
Is that a question for me? Because I'm going to pass that straight on to Madeline.
I'd be happy that it's committee's decision, not mine.
Okay.
We do have invited RBH to our next meeting to understand how they've been working with the council during the pandemic. So that's possibly something that we could kind of encompass into that.
If we pre-warn them that we have a question around that, then I'm sure they wouldn't mind. Well, we'll soon find out if we do ask them that. How does the committee feel about that? Do you want to hear more about that? Or...
Yes, please.
Yeah.
Yes, please.
I'll email Victoria Parker and say there'll be a question around that so she can come prepared.
Okay. Jim, is that it? I'm going to assume yes, because you haven't got your microphone on.
I'll come on. Yes, that's to be done. Thank you.
Okay. Over to Adrian Mata now. Hi.
Yeah, I'd like to say to Nick and Jonathan, you know, really appreciate your efforts and carry on the good work. Understand it's a very difficult time at the moment with sources of information having to be more remote and less face-to-face interaction. Understand that completely. I think it's, if I'm honest, you know, if I look at all this content and read between the lines, what it's really saying is the people who are least well off, least in a position to get access to services, they're the guys that are falling between the cracks. I think we need to have a concerted sort of action plan for all these different groups. I think it's great. You know, you're helping the people with information and documents and things, but you know, it will be great, in my view, to follow up and find out if they're really getting access to the necessary things, and if they're not getting access, then you know, we need to create a sort of remediation plan or something so that we can really get on top of the access issues. I also really agree with the comments that have been made by everybody else on this committee, especially Mr. Fruin's comment. You know, I'm really interested in, you know, trying to identify how we can support. I know in the examples provided, there was a nomad person. I think it was in Morrison's Woos Hill. You know, that's my area. If you want any support from a councillor in Evandens, whatever, let me know. I will try and help you. But I also agree with Councillor Fruin's point that, you know, we should be seeing, you know, what this committee, what the council can do to support you generally. And that really feeds back into my previous point, which is, you know, maybe you can start making out an outline plan as to what you want to do, where you want to go with all these access issues for different groupings, different minorities.
Yeah, thanks very much for that, Adrian, for the offer of help. And I'll come on to the Morrison's thing with the addendum part. I think what it's shown myself and my colleague, those organisations supporting vulnerable people who were well set up, and I don't know why some were well set up and some weren't, various reasons. Those who were set up well, I would say, have managed much better. So if you look at the CLASP Adult Learning Disability Group, right from the offset, they had Zoom meetings set up and had twice weekly Zoom meetings that were attended by a large number of the people who would normally attend their physical gatherings. So it allowed people like Health Watch, but all sorts of other people to go to those meetings. Matt Pope went there and gave a presentation a few weeks ago. John Redwood turned up and took questions. So it really gave them the support they needed. When I spoke to the people who run the carers organisation, and I'm not criticising anybody, absolutely not, I'm not doing that at all, because we used to go along to some of those carers groups before the pandemic to hear what was happening. They didn't have any such things set up. Some of that is clearly because they were an older age group and they maybe didn't have the skills or equipment. But I think it'd be really good for Wokingham Borough Council, because I think that job's far too big for Health Watch, to look at some point who was able to have face-to-face contact, albeit digital, of all those voluntary and community sector groups, and those that couldn't, why was that?
Sorry, can we carry on that topic? You know, so we actually had a sort of bi-monthly meeting with Matt Pope today, actually, and you know, he was saying that, you know, he's the cooperation, the working together with certainly a number of voluntary sector groups has definitely improved, and you know, he's definitely a guy that is willing to sort of roll his sleeves up and get involved. So if there's an action to provide one group or another group or whatever it is with some sort of mechanism, electronic mechanism, whatever, let us know. Let us know, and you know, I don't see why we can't pass that request on to Matt Pope, you know, to set up a sharing mechanism on Teams or something. That should be achievable, surely.
Yeah, you would have thought so, wouldn't you? And I'm not saying that those carers didn't get a service at all, but it was a different service. It meant the carers support group, Wokingham Outreach Carers, would have to pick up the phone and call them. But that's not quite the same as seeing faces of the carers, that, you know, that peer support that the class group could get, because they were seeing everyone on the screen, you know, and they had their singing sessions and they had their talking therapies come in and talk to them about anxiety and all of that sort of really great work. They just ran their yearly Learning Disability Partnership Roadshow, which Health Watch Woking are one of the champions on that board. So we helped arrange that. And we couldn't do it physically, and a lot of members of that are from class. So we did it over a period of 4 days, 2 hours a day, with people coming in from Wokingham Council to talk about the benefits of exercise on your mental health. Talking therapies were there, singing sessions, but lots of informative sessions. So it can be done. It's just what are the barriers to the people who are not doing it?
Yeah, I think if you can firm up on the requests that are outstanding, you know, we can see, you know, we can put that back into the mixer and see how we can support.
Yeah, okay. And in terms of, the question was asked earlier and I didn't answer it, in terms of how you can support us. Yes, absolutely you could, in terms of us going forwards and contracts. What I wouldn't want to do is go through the same palaver again in a year and a half's time. But I think what I'll do in that is I'll get Jim Stockley, the chair, to write to you about that.
Yeah, that sounds like a good plan.
The one other thing
what I also meant was around individual cases. You know, we've talked about the dentist, we've talked about the pharmacist, we've talked about the nomad packs. All these different things ultimately end up with, you know, people in very difficult situations where their case is not being addressed. Yeah.
Yeah, well, can I talk to you about one now as an example?
Absolutely.
Let's call this lady Mrs. F. So I got involved because she lives in Norris. She's a single mother, her husband passed away. She's got 4 children, 18 and under, I believe. I was contacted by the children's social worker, who was concerned because she had an ulceration on her leg, which had got really bad. She couldn't get up the stairs, so was sleeping on the sofa, which was affecting her back. she couldn't get out and walk around. She was being seen by the district nurses. It's just before COVID. That's the point I was contacted. The issue was they weren't turning up 3 days a week like they were meant to do and redressing it. It might be 1 day, it might be 2. 1 week, it might be 3. So the children, the eldest daughter was expected to dress her mother's leg, no training. So was doing it the best way she could. The district nurses, when they weren't coming, were meant to be dropping off bandages. Sometimes that didn't happen. So there was a couple of occasions when the daughter had to dress her leg using a sanitary towel. Sorry, there's no other way of... So I spoke to Berkshire Healthcare Foundation Trust, and after that, she was being visited 3 times a week again.
And that's a very sad story.
Well, it does get worse. I was contacted just before I went on holiday last week by the children's social worker saying because her leg has improved, but it's still ulcerated, and she's a little bit more mobile. The district nurses have discharged her from that service, and she will have to walk to Wokingham Medical Centre to have it dressed once a week, with the expectation that her children can dress it the rest of the time. Doing the research, it's not that that's very unexpected that a family member could dress it for you if that makes it easier for you, but they should receive training on how to do that. So that's an issue that I was going to raise with Adult Social Care and Berkshire Healthcare Foundation Trust. But it's good to know that I can come to a councillor for Norris, and say, look, one of your people are going through this horrible situation.
And you know, I mean, I can't talk about Norris, but certainly Evandens. You know, if you came to me with a similar case, I would be, you know, drafting some letters out.
Right.
In support of that poor lady's case.
Yeah. Thanks very much for that. The one other thing I would mention around collaboration, in case you don't know about it, and I would agree, collaboration across the board's gone through the scale because people have had to do, you know, and they find it works. So that's one positive going forward. A few months ago, maybe perhaps even a year ago now, a guy was commissioned by the council to write the new voluntary and community sector strategy, and he invited people from those organisations to give their feedback to him anonymously. Several of them, including Health Watch, talked about the setup in other, not all towns and cities, but some towns and cities, where they had the council used their assets to provide a community hub so that these voluntary and community sector organisations, those who wanted to, could work out of the same building, which would make collaboration much easier. Because, of course, somebody coming into contact with one of these organisations, their issues will be multifaceted. They might think they've only got one problem, but they've probably got more. And dealing with the issue and then giving them a referral form and sending them somewhere else, it never really happens very well. So the council have accepted that's a good idea based on the experience of COVID, and they're deep into the plans of providing a building for the co-location of community voluntary sector groups and other people, which may include some council workers. So I'm on those boards. They've identified several buildings already. The plan was to have that in place by April. And when it was questioned, I don't think that's really possible. The answer from Martin Sloan was we're going to make it happen by April. So that's a positive thing.
I think there's been some streamlining of phone number contacts and these kinds of things, and all of this. Should I say simplification of service contacts should be applauded. But I think I particularly like the idea of a central hub. Do you know which buildings have potentially been identified, or is that secret information?
They've identified one. The other three weren't at a stage where they could identify, because they've set up several boards. There's a commissioner doing this. He's been commissioned just to implement this project. So there's several boards, partnership boards, but one of them is about buildings and assets. And I sit on that one. And the last meeting I attended was a couple of weeks ago. I said I was on holiday. So they couldn't identify the other three, but they hope to do so by the next meeting. The one they could identify, they're all centrally located, is the building opposite the Citizens Advice Bureau. Seymour House, is it? And that's interesting because it's almost got a shop frontage, so you could have a front desk. But ultimately, I think it'll probably come down to cost. The key thing for the voluntary and community sector groups was, don't stick us in an industrial estate down Molly Miller's Lane, because that's it.
Thank you very much.
Ken, your mic's off. Ken, your mic's off.
Oh yes, so it was. Thank you very much. I just want to say, Nick, that the mystery shop results are very interesting to see. I wondered, I noticed you missed out the private sector as a comparison, and I think that was right, because it would confuse the details that would have come back. But I wondered how the private sector compared to what the national health sector was doing. I'm going to take a wild guess that they were probably even better with their functionality than the NHS ones. But is that a presumption that's wrong or right, do you think?
It was mixed. You know, some of the private practices websites were very slick, as you would imagine.
Yeah.
Very slick. But there were some that weren't that great either. The general impression I got when we did it was they didn't seem to put a lot of effort into the build of their websites.
I know what you mean. Okay. I was also quite pleasantly surprised. I think that what the mystery shopping found was better than I expected, really. I had a funny feeling this was going to look a lot worse than it actually is. So that's a good thing, I guess. But there are big gaps between the satisfactory and not satisfactory arena, isn't there? The Nomad packs.
Sorry, I would say I've sent that. I don't think I mentioned. I sent that off to the Southern Dental Committee just before I went on holiday, and I saw a response from them saying they were going to look at it. So, but okay. I'm not back at work till tomorrow, so I can't give you an update.
Oh, we've got you back into this early then. I apologise for that.
Right.
I was just wondering about these the Nomad packs that you said Morrison had a problem with. I just wonder if you could remind me exactly what that problem was. Was it where they withdrew the Nomad pack?
Yes. Yeah, so one of the learning disabled adults reported to us at their Zoom meeting that he had had his Nomad pack withdrawn. So as part of that, he had lost some of his independence. I spoke to Morrison's and said, this guy's had his Nomad pack withdrawn. Yes, he has. We're too busy. We haven't got enough staff. And I accept the difficulties of Nomad packs and the time it takes. And I said, well, have you withdrawn all Nomad packs? To which the answer was yes. This was on the phone. I then found a directive. I can't remember the name of the dental oversight committee. There was instructions from them that to dentists that they were within their rights to review Nomad packs based on the situation that COVID presented, But if they were to withdraw them for vulnerable people, they had to carry out an assessment for that individual and send them a letter explaining their reasoning. So I asked the individual, they said they hadn't had an assessment as far as they were aware or received a letter. So I wrote to Morrison's and made those points. When you withdrew them, did you carry out an assessment for everyone? And did you send a letter? And they didn't respond to that. So I asked Kevin Barnes to follow that up. Just before I went on holiday, I said I haven't had any luck contacting Morrison's. You know, I've emailed them twice. He came back and told me briefly that the pharmacist said they carried out an assessment. The way they carried out assessment was by contacting their GP. Well, that's totally not in line with the instruction they were gave. So I need to follow that up.
Yeah, they're sort of missing the point of why they're doing it, aren't they, on that? That's interesting. Oh, okay. Are there any other questions? I can't see any hands up. Well, I think in that case, Nick, look, thank you ever so much for your time coming in and speaking to us. Oh, hang on, we have Clive. You're muted, Clive. You're doing it.
You're still muted, Clive.
Sorry. I need to apologise to Nick. I've been calling you Jonathan all night. Sorry.
That's okay. The only other thing was the addendum. So those extra points I wanted to make.
Oh, would you like to go into those now?
Yeah. So there's only a few items. We've already spoken about the pharmacy issue and the Nomad Pack. So I'll update you next time on any progress there. And I sent you the RBH rebuild government press release, which details all of the different rebuilds around the country. I attend the flu vaccination action group, which includes the CCG, Royal Berkshire Healthcare Foundation Trust, where they talk around what's currently happening. So I can give you an update from the last board I attended, which was about 2.5 weeks ago. So the issues they talked around flu vaccination was there was concerns about practices getting their PPE, and all practices had to register for this new digital portal to order their PPE. The PPE for the whole area was being run out of a warehouse in Buckinghamshire, but that's being closed down now. So it'll be interesting to hear at the next flu action group whether the people have had any difficulty getting PPE from those digital portals. They also talked about it's really important that we make sure we get flu jabs for those who are looking after shielded and housebound people. Now, Berkshire Healthcare Foundation Trust said that's all very well, and yes, they should be vaccinated, but what they don't do is carry around hundreds of extra flu vaccinations in their car just in case there's somebody else living in that house. And they can't get the names from the GP because they don't link the patient names together. So what they're saying is, if they do have any spare, they will vaccinate those people who are either shielding in that household or the carers of the housebound. So there could be some issues with that. Berkshire Healthcare Foundation Trust also said they've got some concerns about their capacity to do it this year, because before they would just go into the house, you know, maybe with a mask on, maybe with a pair of gloves, they'd vaccinate them and they'd be out the door. Now with the necessity to wear the PPE, it doubles, triples the time that they have to spend at each house to carry out the vaccination. And there's also the worry about sickness to staff. So we'll get an update on that, whether that's been an issue. The RBH have started vaccinating their staff, and they've had a 60% uptake. Interestingly, you would think every staff member would have a vaccine, but that's never been the case before. You know, it's not even got to 80% because people might be vegan or it's a religious belief, which was interesting. The other thing they're doing is anybody who attends a maternity appointment, the women are going to be asked if they've had a vaccination. If they haven't, they're going to be offered one there and then. So that's positive. There are some concerns about supply of vaccine to doctors, but we'll get an update now. We're well into it at the next meeting. That's the update. And the only other one was, you know, there was the big fanfare about everyone between 50 and 63 would be vaccinated. Mm-hmm. Well, yes, only once all of the vulnerable groups have been done and if there's any vaccine left. And that's unlikely to be till November, December, which is way into flu season, which is a bit concerning. The other thing I wanted to mention was the CCG patient survey results. I was contacted by one of the managers at the CCG to go through the patient survey results for Wokingham. They haven't published them yet. There were lots of questions that the patients were asked to answer, and it showed the results for the whole of West Berkshire. The concerning thing was there's 3 or 4 Wokingham surgeries very often were in the bottom 5 or 6 of the numerous surgeries across West Berkshire for all of the questions. Wokingham Medical Centre, bottom of almost every single one. Woos Hill, very low down on all of the questions they were asked. But then you'd have an outlier like Wargrave surgery, which was right at the top across West Berkshire for many of the questions that patients were asked. So would you like me to share those survey results with you when they're published?
Yeah, very much so, I think. Yeah. Yes, please, if we could. That would be interesting to see.
Okay. And the final thing to mention on there is the report. So it was just to tell you what's coming. I know you've been waiting for the perinatal mental health report. That's out with service providers for their feedback by the end of the month. So it'll be with you sometime after the end of the month. It's just ready to go with their comments in it. We also did a mystery shop on GP websites. That's finished, waiting for sign off. So we'll share that. There was some recommendations in there. And the COVID survey report is just waiting for sign off by the board. So we'll be sharing that with you shortly.
That's great.
That's it.
Nick, thank you very, very much. Now, any other questions? Emma, can I go across to Emma?
Thanks very much, Mr. Chairman. I've just got one thing I could give a bit of information for. I had a flu jab last week or the week before, I lost track, and I was the last person to be given the flu jab in the chemist because apparently anything excess within those chemists was going to the NHS. So I don't know if this assists at all. And that's what I was told when I was in pharmacy in Twyford.
Mm.
Oh, very interesting. Thank you.
I was told something quite similar at a pharmacy in Wokingham.
Who said that? Was that Rachel?
Yes, it was.
Oh, thank you, Rachel.
So I've got a flu jab booked in for next week, but when I was booking, they said I had got the last but one vaccine and that they wouldn't be getting any more in.
Sounds like that's going to be the end of it. All right. Any other questions? No.
Just say, Mr. Chairman, I don't think it's not getting any more in. I think anything that's with chemists at the moment, with flu, the jab, any excess that the chemists may be holding, apparently have to go back to the NHS. That's what David told me.
Well, that makes more sense, actually. Yeah, if it's excess, why would you want to keep it? Yeah. Okay. Adrian, question?
Yeah, it's probably for Madeline, Ken, but can we again ask the dentists to come and see us? I think we should continue to ask them, because you know what we hear every time we have a meeting is there's a problem with dentistry, and then they don't turn up. So can we continue that request?
There is a request, and it's currently under review at the moment.
Thank you very much, Madeline.
Okay. Any other questions? I can't see any hands. All right, back to the agenda, and I think that's the only item that we had this week. So, yes, on that note, I'll close the meeting. Thank you very much for your time, especially Nick, for the excellent presentation you gave. Thank you very much.
Thank you.
And also, Madeline, thank you for your help. It's always welcome. And I'll see you all at the next meeting. Thank you very much. Goodbye.
Super. Thank you very much.
Thank you.
Bye.
Good night.
Thank you.
Thanks, Madeline.
Thank you. Good night, everyone.
Good night.